Along with the excitement that comes with pregnancy comes the fear of pain during childbirth. Let's see how we can make it stress-free and a pleasant experience. Hi friends, this is Dr. Rajeshwari Reddy. I'm a gynecologist, a obstetrician and a laparoscopic surgeon with 17 years plus of experience from Hyderabad. Many people start asking me right in their first visit if they will have a normal delivery, or what they should do to have a normal delivery, or that I should give a good treatment which will increase their chances of normal delivery. So let's see what is normal delivery. A normal delivery is the delivery of a full-term baby with the head presentation through the vagina at term with minimal intervention. So when does delivery actually happen? The ideal time for delivery is between 37 to 42 weeks. So how do I prepare for normal delivery during my antenatal period? Be physically active throughout your antenatal period. Do moderate exercises like walking, yoga, do squatting exercises, butterfly pose of yoga, duck walk exercise. Try swimming because it is the best exercise for expectant mothers. Have a good sleep every day. That keeps your energy level always high. It is very helpful to have a positive mindset and always be relaxed. Undue worrying may prove detrimental to your health. Avoid putting on excessive weight. Stay upright and mobile during your delivery time. One has to be mentally prepared. The mindset plays a huge role in the preparation for normal labor. It is very important that you select a doctor you're very comfortable with and also someone who promotes normal delivery. I see that people who are mentally prepared to undergo the pain and have a normal delivery have more chances of having a normal delivery. One should come to the hospital if they start having labor pains or they have uncontrolled leakage of fluid from the vagina or bleeding or reduced fetal movements. So how can you make out if it is a labor pain? Labor pain typically starts from the low back radiating to the front of the abdomen. It is intermittent. There is gap between pains and it is progressively getting intensified, and the duration of labor pain keeps on increasing with time. Leaking might be sometimes in drops, or sometimes there might be a sudden gush of fluid from the vagina, and this is involuntary. One cannot hold the vagina tight to stop the leak. The bleeding might be frank red fresh blood, or it might be a blood stained mucus coming from the vagina. And if there is reduced fetal movement in the last 12 hours, there is definitely a need to visit the hospital. So once you reach the hospital, we do a CTG and an ultrasound if required. We also do a vaginal examination to assess the stage of labor. Then we counsel the patient and the family members about the status of the delivery before shifting to the labor room. Sometimes this might prove to be a false alarm, which is when patients are not in true labor, in which case we do a CTG, confirm that the baby is in good position, and send the patient back and ask them to come if the pains progress. In the labor room, a gown is provided, the private part preparation is done, a IV line is secured, and the medications are started as advised by your doctor. Patient is advised to take small light meals intermittently to keep her energy level maximized all through the labor process. There is continuous fetal heart rate monitoring. The frequency of per vaginal examination is based on the progression of labor. So as the labor progresses, we repeatedly keep counseling the patient, keep encouraging them, ask them to move around, make them well hydrated. We give them enough fluids intravenously and also ask them to drink as much as they can. And once the patient reaches the active stage of labor, which is 3 to 4 centimeters of cervical dilatation, we also give an option for painless labor. With each examination, we inform the patient and the attenders about the progress of the labor regarding the dilatation of the cervix, the effacement, the descent of the head, and the intensity of the pains. 10 centimeter is when the cervix is fully dilated. Once the cervix is fully dilated, we look for the head descent, which happens along with the dilatation as the labor progresses. So, when the head touches the perineum, there might be a sensation to pass stools. When the head is seen from the vagina, and with each passing pains, if the head does not regress back, we call this as crowning. At this point, we give a episiotomy, which is a small cut in the vagina, on the side of the vagina, which makes the vagina little more roomier so that the head can pass easily. Patient is encouraged to push with each contraction, and if the husband is interested, we also allow them to help the patient to push the baby. With the intensity of the contraction increasing and the efforts of the patient to push down, the head is delivered, and then the body and the legs are delivered. The cord is clamped and cut. The baby is handed to the pediatrician. Then the patient relaxes. We ask them to take a few deep breaths. We also give them some water or glucose or anything that they would like to have. Then slowly the placenta and the membranes are delivered consecutively. Then the vagina and the uterus are cleaned. Episiotomy is sutured in layers, of course with local anesthesia, and all clots are removed. Patient is cleaned and shifted to the room and advised to have light meals. As a gynecologist, the safety of the mother and the child is of utmost importance. If at any time during the process of labor we find that the baby or the mother is distressed, we will opt for a C-section. Of course, all of us want to have a normal delivery to happen, but not if it is unsafe for the child or the mother. It's very important that you trust your doctor, you be confident that they are doing the right things for you, and allow them to take a decision whether to proceed for normal delivery or go for a cesarean section. At the end of every experience, when we talk to mothers and ask them what was their experience about the normal delivery, I have not come across a single mother who remembers the pain. They remember everything else about the labor process, the delivery, the baby cry, and little bit of chaos that happens during the labor. But I don't hear anybody telling me how painful it was, and probably that also explains how people again have a second child and again want to go for a normal labor. So there's no reason for you to be unreasonably worried about the pain during normal labor. Thank you.